My name is Mark Scott. I am Professor of Planning in UCD and I'm also Principal Investigator for the EcoHealth Project. There is an inextricable link between environmental quality and positive health outcomes. We know that environmental degradation, such as poor air quality, has negative health impacts, but less is known about the potential positive impacts of environmental goods, such as green and blue spaces, and the benefits they have for our health outcomes. In 2015, the EPA and HSE launched a joint research call to support the implementation of Healthy Ireland and to develop an evidence base on the relationships between environmental quality and health. The aims of this co-funding were to develop national capacity in this important area, to generate data to make evidence-based decisions, and also to mobilise this knowledge for the use in environmental and health protection. The call focused on examining the health benefits derived from green and blue spaces, and 3 projects were funded. Near Health, led by NUI Galway, GBI Health, led by Maynooth University, and EcoHealth, led here in UCD. Together these projects examined the value of green and blue spaces as part of Ireland's essential health infrastructure. We sought to enhance the evidence base, identify research gaps, and develop toolkits for policymakers and local communities.
My name is Dr. Ronan Foley. I'm a lecturer in the Geography Department at Maynooth University, and what I want to do now is just give a very quick overview of the 3 projects that we were all involved in. So I was the PI on the GBI project looking at green and blue spaces and health, and the main aim of that project was to model using GIS and statistical methods the relationship between the amount of green or blue space an area had, what we call green-blue infrastructure, and a series of different health indicators. So we basically modelled the amount of green and blue in an area against health data, things like mortality, self-reported health from that area. And we found a generally positive association from those relationships, but also some important findings in terms of what types of health data are out there for one to do some statistical modelling on. The second project, the EcoHealth project, or Ecosystem Benefits of Green Space for Health, was led by Professor Mark Scott from UCD, and that project was much more around the design and planning elements of the work. So the project worked on the perspective that accessible and well-designed green spaces are essential infrastructure, so it was taking on the infrastructure idea, but looking at the specific design of green and blue spaces around how they could promote physical activity, enhance mental well-being, enhance social interaction, reduce environmental risk, and mitigate environmental risk through good design protocols. And the end point of that project was also to make some policy guidelines and policy recommendations in terms of design, so kind of create a sort of design tools. The final project, led by Katrina Carlin and her team at NUI Galway, was called Near Health, Nature and Environment to Attain and Restore Health. And that particular project was working much more on a community level, so kind of moving on from external data to design and planning down to kind of more experiential and community level activities. So they were really interested in exploring how people valued and experienced nature for health and well-being, looked at some of the bridges and barriers to nature connection. A lot of very good sustainable explorations in there about what people want for future healthy environments, and in particular developed a lot of small work around nature-based activities. So very interested in what people did in green and blue spaces and how communities work together. So the research certainly highlighted the value of investing in and planning for better access and use of biodiverse outdoor public spaces. They particularly demonstrated the role of blue and green space to enhance ecosystem and human health and resilience. And I think they also, from working directly with people and co-producing knowledge with local communities in and around Galway, but well beyond Galway as well, identified solutions regarding people's values and perceptions around how nature and blue and green space worked for them. And as a final output from the project, they developed a series of how-to guides and some toolkits to allow other local authorities and other communities to benefit from the work that they developed.
I'm Katrina Carlin. I was the principal investigator with the Near Health project. 3 broad themes emerged from all the 3 research projects. Firstly, there are quantifiable health and well-being benefits from using green and blue spaces. Secondly, we know the features of these green and blue spaces, what makes them of value to people, and we also know what deters people from using them, like things like litter and neglect. And thirdly, we know that using these green and blue spaces can be integrated into a way to live more sustainably and to be more resilient. We know from what Ronan has told us already that these green and blue spaces include parks and gardens and forests and farmland and coasts and seashores. But really it's anywhere that you can get out into nature. We know that there are physical, mental and social benefits from being out in these green and blue spaces. GBI for Health demonstrated techniques to collate, overlay and aggregate health data. As well as providing a critical analysis on the availability of health data, they identified where there are gaps and also opportunities for future research. EcoHealth developed key design principles to maximise green spaces as health promoting environments. Near Health developed a toolkit for individuals, communities and practitioners to connect with nature and develop their levels of engagement. What this shows from all these research projects is that these places are of value, but they must be accessible to all ages and all abilities, and they must be protected and cared for in the long run. And also we need more of them because they're important for our health and well-being and also for a healthy environment.